Good evening. Welcome all, Rutgers faculty, staff, students, alumni, and friends. My name is Brian Chu. I'll be moderating tonight's events. I'm an associate professor and department chair in clinical psychology at the Graduate School of Applied and Professional Psychology. Tonight, we're in for a real treat. We have the pleasure of securing some precious time with two of our most impactful leaders at Rutgers University, Provost Francine Conway and Dr. Frank Ghinassi, who will be sharing with us news about a tremendous new effort that will elevate Rutgers' accomplishments as a land-grant institution, promoting service and science for New Jersey citizens and beyond. We are here to talk about the Brandt Behavioral Health Treatment Center and Residence, an effort launched by a transformational gift from Rutgers alumna Marlene Brandt, a treatment center committed to the complete continuum of care for youth and young adults. In the second part of the Better Together event series, we are fortunate to be joined by Dr. Francine Conway, Provost and Executive Vice Chancellor of Academic Affairs at Rutgers University in New Brunswick.
Welcome, everyone.
And Dr. Frank Ghinassi, President and CEO of Rutgers Health University Behavioral Health Care. Greetings. To give the audience a sense of the format for tonight, we decided to keep this conversational, allowing the two leads of this project the chance to really tell us more about this initiative, describe how it came to be and what lies ahead. I have some prepared questions and also some attendees submitted questions at registration. The Q&A line will also be open, and we'll try to get to as many as we can so that we can hear some more about what this program really means for Rutgers and the community. But first, we thought it'd be helpful to show a video summarizing this incredible initiative. Please roll the video clip.
The opportunity that the Brandt Center provides is really to serve as a model for access. More than half the youth who actually need behavioral health services have difficulty accessing those services. The Brandt Center will generate research that will fuel the science of behavioral health and future treatments.
Her gift has allowed for the creation, literally from the ground up, of something that simply doesn't exist in New Jersey and, quite frankly, doesn't exist in most parts of the country. A comprehensive array of services that are all housed within a single campus.
Not just psychology and psychiatry, but social work, education, nutrition, the arts. So it's a really comprehensive, holistic approach. It's the whole person.
Putting that all in one place is really only the kind of thing you can achieve when you have somebody who provides you with the resources to put the pieces together. It's going to revolutionize the way care is delivered to these young people.
Well, we have a lot to talk about. Why don't we start from the beginning? How did this come to be? Frank, Provost Conway.
This began as a very long and heartfelt conversation with Marlene Brandt. She was beginning to consider her future as part of the Rutgers community, being an alumni, and came to the university to begin to talk about what possible projects might she be able to get involved with moving forward, things that were a passion for her. And over the course of time, a number of different projects were discussed from really a number of areas across the university. She landed on the beginning of what ultimately became this project. And maybe I'll pass this over to Fran to talk a bit about what were some of the things that may have motivated her to land on this particular one.
Yes, I would say thank you, Frank. And Brian, it really was a pivotal moment in the conversation when Marlene shared her story and her desire to help the youth of New Jersey. We saw this as an opportunity to partner with her to develop a quality program that will meet the need. The Brandt Center is designed to provide outpatient care for adolescents and young adults, as well as residential care, who are facing many challenges, the challenges of depression, anxiety, eating disorders, substance use, and other psychological disorders.
Well, how does this stand out? Considering all the resources and services at Rutgers, where does this fit into that landscape?
I think one of the things that's going to be revolutionary about the program is the fact that it is assembling a multidisciplinary team that includes not only psychologists and psychiatrists, but also the full range of behavioral health and healthcare professionals, to include dietitians, nursing, social work, creative and expressive arts, individuals who can provide peer support, a broad range of treatment, all of which is combined into both individual and group level treatments, and which stretches across two distinct levels of care, one which is residential and one which is ambulatory, where individuals go home in the afternoon or the evening and use the center in a more traditional outpatient way. The other thing that's enormously unique about this is that it combines all three of the primary missions of Rutgers University. And I'll pass this over to Fran to talk about that rich combination of clinical and the other important missions here.
Yeah, thank you so much, Frank. Really locating the center at Rutgers allows us to utilize the best psychiatric and psychological science, the best medical science to treat a range of overlapping co-occurring problems. And as part of this initiative, the university has pledged to work with, providing the resources to bring together all of the researchers at Rutgers who can lend their lens and their expertise to solving these kinds of problems. And when you think about why should we care, the youth, they're the next generation of citizens that will be our neighbors, citizens of our nation. And they do grow up to be contributors to society. And we're at this inflection point in our society, and where we're looking at the youth as a pathway to the world's future. So we need to begin prioritizing health, well-being, and development of the youth. And so when we bring our research enterprise together with the clinical training, it makes for just a perfect force and ability to make an impact and make a difference in the space.
The other beauty of this is that because there will be clinical services provided by this rich array of professionals, and there will be research, which is really a hallmark of what sets apart an academic mission when providing research from a straight clinical mission, it's a real chance to advance the science. And finally, and in addition, because many trainees from all of these professions will spend time, including psychiatric residents, clinical psychologists, nurses, social workers, dietitians, all of the professions I mentioned before, this offers us yet another opportunity to convince some of these young people that we train here to stay here and to become not only the next generation of caregivers, but with some hope, perhaps the next generation of caregivers right here at Rutgers Health.
I'll confess, all that seems exciting, but it also seems like a lot. If you could boil down like the mission for the treatment center and residents into a nutshell, how would you describe that to someone who's trying to make sense of this new resource?
I would start by saying that it would be the place that I would recommend if I were sending my family or friends, that it would be a destination of choice for a comprehensive, evidence-based, and compassionate delivery of what we believe is the most effective treatment available to these young people.
That sounds pretty impressive. And would you say that works hand in hand with the research and training mission, or are they separate? How do they dovetail off of each other?
So I know that the Graduate School of Applied and Professional Psychology is in the process of developing an institute, a research institute that focuses on youth behavioral health and wellness. That institute, which pulls together the talent at Rutgers that specialize in research that focuses on behavioral health will be used to inform the treatment that's being provided at the Brandt Center. So the two will work hand in hand. The students will be trained there as well, as Frank mentioned. So it's a real win-win for everyone, providing the best care, bringing the best science to bear on informing that care.
There are a lot of, and some of the questions that we received early on kind of focused on this, that there are so many pressing needs in society today, in particular, the impact of the COVID-19 pandemic, the very obvious mental health access gap. How will the Brandt Center help address some of these pressing needs that we're facing?
Well, I think first and foremost, what we've seen during the last year, quite unlike anything anybody of the current generation has really seen, is a dramatic increase in people reflecting, if asked, that they feel increased depression and anxiety. These are two of the most common issues that are being raised. The target of the Brandt Center is really to dramatically improve the availability and access to treatment for exactly that: mood disorders, depression, and anxiety. So it's adding an entirely focused resource at a moment in time. You know, it's ironic, we did not plan this with the pandemic in mind. We planned it because we saw a lack of availability of these kinds of services in this kind of coordinated way. I think it will uniquely serve some of the secondary outcomes of the pandemic. But more important, it's going to increase access to young adults and older adolescents, really from across the state. It's going to provide that opportunity to give this kind of coordinated evidence-based treatment to many, many more young adults and adolescents that we've been able to serve with our current capacity. Fran?
Oops. Yes, and I also want to add that a big focus of our researchers have been on dissemination. So many of the work that's done at the Brandt Center will be disseminated to other treatment facilities. And currently there's no organization in New Jersey that offers world-class inpatient mental health treatment, and especially backed by the resources of an academic health leader like Rutgers. And when we consider that 1 in 5 youth in the United States have a mental health problem, and in New Jersey alone, there are over 72,000 youth suffering from major depressive episodes. You know, we really have an opportunity here to begin to address the need, not only through direct care, but through the research that is generated through this institute and disseminating the lessons that we learned from working and helping the youth in New Jersey. And I think in 1 year alone, between the institute and the treatment center, we can touch the lives of 300 adolescents and youth and their families by providing this continuum of care from residential to intensive outpatient and outpatient psychotherapy services. So I'm very excited about this opportunity.
As we ramp up over the course of the first year after the construction, as Fran said, we're going to be able to provide services to 300. And as we ramp up and we are in full operation, which will probably take 6 months to a year as word spreads, we're going to be able to flex up, and the physical space of the facility is going to allow for about 200 residential individuals over the course of a year, and for about 1,500 outpatients once it's fully ramped up. That dramatically increases the capacity of the people that we can currently serve. Even though we are in this space and we are serving, this adds a significant amount of both access and availability of this kind of expertise. It really is going to be a game changer in New Jersey.
Tell me more about that continuum of care. People had questions also about whether or not there would be a crisis response setting, what it would look like for someone to progress through the whole continuum from residential to intensive outpatient to outpatient and aftercare? How would that look, and how would these parts work together?
Well, I'll start, and then I'll let Fran join in as well, obviously. So not everybody will start in residential. That's going to be a small component. You know, really, it's going to end up being a smaller part of the overall impact this is going to have. Many of the individuals that we're going to be working with may have already done an inpatient stay, which is different than this. This is residential. So they may have been at our hospital in Piscataway or one of the child units in our affiliate, the RWJ Barnabas system. They may come out of an inpatient stay and go directly to, let's say, a partial hospital or an intensive outpatient program where they may come 2 to 3 days a week, 3 or 4 hours a day. They may be brought to the center or referred by mobile crisis teams, which we already have in place, who respond to crises in the community. The path through partial hospitalization, outpatient, intensive outpatient, individual one-to-one outpatient, and the residential program will actually be unique for each young adult and adolescents. It'll be based on the need with which they present at the time we meet them and their family. Fran?
Yeah, I just want to add also that just to say a little bit more about the residential piece, that parents will no longer need to leave the state to find high quality, evidence-based care for their young adult or for their youth. And that's been the driving force behind this project, that many families felt they needed to leave the state to go to other places. And then that created a discontinuity in care. So when they returned to the state, now they started with a whole new team, really didn't have the team that treated them when they were in the residential component. So what we're looking to see is our families, our youth being able to, for those who are in the residential setting, to step down to the intensive outpatient and then step down to outpatient psychotherapy, and having that continuity of care is really, really important. And what's nice about this facility is that while we'll be able to provide services to a broad range of folks in the on the outpatient side, the residential side also has a specialized suite of offerings that's provided for the residents while they're on campus, and being able to participate in a range of therapeutic activities. So the psychiatrist is key and is important, but also, you know, we're excited about offering things like nutrition, cooking classes. Rutgers has the Institute for Nutrition and Health that's really remarkable, you know, taking advantage of, you know, working with the horses and the animals, the full complement of the different species that are offered in the gardens. So we're really integrating the university and all of the expertise here, and it's right at their doorsteps. And that's what's really exciting about this. These are not services that we would have to go out and seek, and it really enriches the care for the residents.
And each of you have alluded to this, but there was a question about whether or not services would be limited to just Rutgers alumni, or whether it would be available to New Jersey residents writ large or even broader. My impression is that it's available to anyone who's able to make it here.
That's true. This is intended for any and all of the residents of New Jersey. Our suspicion is that it will probably also draw some people from the New York metropolitan area outside of the state as well. It's possible. There are programs that have some aspects of what we're going to have in this program. And I have seen people travel to those programs. Many of them left New Jersey to seek out you know, programs that were somewhat similar to this. So yes to all of New Jersey, and yes, possibly to some of the neighboring border states.
Yeah, and I imagine as we continue to work in this very systematic way and really bring in the research and make some, innovative advances in terms of mental health and behavioral health treatment, that folks will come and, whether it's to receive care directly or to learn from what we're doing at the center.
Well, a related question is, it seems like there could potentially be really large demand for these kind of services. How will beds and space be allocated? How will their services be kind of not guaranteed, but accessible to people?
Well, we're building it, like most programs that we build. We build these things. In this particular case, philanthropy has played a big role in allowing for the actual physical campus to be built. That wouldn't have been possible without Marlene Brandt. And I think providing that kind of campus and that availability, which will be a draw for many people, is a wonderful, wonderful opportunity for both Rutgers and the state of New Jersey. But when we build the clinical model, we build that in a way that is sustainable through utilizing both public and private insurance, which is why we mentioned that in the ambulatory program, it's going to be available to everybody, because we're going to work with individuals who have commercial insurance, which many people who are fortunate enough to have jobs do. We're also going to work with people who have public insurance, like Medicare and Medicaid. And because this is New Jersey, we will help those individuals who aren't connected to things like Medicare and Medicaid to access those services, which is part of their right. We do that all the time anyway. The other beauty of this is that the talent that will be drawn to this program will also allow us to utilize some of what we learn here in some of our other sites where we do treat older adolescents and young adults. So that knowledge will spread to some of our campuses, which are in Cherry Hill, some of our offices, which are in Edison or Newark, our offices in Monmouth Junction. A variety of other areas will benefit from what we learn here. So in a way, that care and what's learned can be promulgated to other sites, including some of the sites across the RWJ Barnabas system, like Jersey City Medical Center, Newark Beth Israel. What we learn here, the methods that we learn here, we can export, as Fran was talking about.
And so it sounds like that the services would not just be reserved for private pay.
No, not the ambulatory services are not reserved for private pay. No.
Great. There's been a number of questions about appropriateness for developmental disabilities like autism, intellectual disability. We've mentioned things like mood disorders, major depression, bipolar, anxiety disorders. What would be the appropriateness for youth and young adults who are coming with, developmental disabilities?
I will say that Rutgers already have expertise in that area. We have the Douglas Developmental Disability Center, and then more recently, our Rutgers Center for Adult Autism Services. And so we are aware that all individuals can experience psychological challenges, whether or not they have, a developmental disability or not. So, but we already have spaces at the university that is providing services to these individuals, and we would be happy to consult for sure and sort of work. But this particular focus is on, I would say, neurotypical youth. Of course, we are always happy to consult and collaborate and sort of share expertise across the campus. But, in that way, this gift is really one that just keeps giving, because the potential to influence and inform so many groups of individuals and provide help and assistance is really there.
This question might dovetail on earlier kind of thinking about COVID-19, although not so much about how it's impacted our populace and client population, but more about how it might impact our services. There's some questions about whether the services will be made available further out, Southern Jersey, but also to people who live further away. It occurs to me that we've had a real steep learning curve in terms of providing services via telehealth, but are there other ways in which this center or service can grow so that it begins to serve more and more people across the state?
Yeah, I think there are, and I think that's part of the evolution of a program like this. This program will produce, it will be a draw for talented clinicians and talented researchers. They will come. Once they're here, we believe we'll be able to draw them because this is an innovative and rich environment, not only for the young patients and their families, but also for the professionals who work there. People want to work in places like this. Because of telehealth, we will be able to take advantage of having many of these services available in more distant locations through telehealth opportunities. It's also important to remember, the audience may not know, we are currently embedded, UBHC has behavioral health expertise physically embedded before COVID, currently via telehealth, but it'll be back to physical once the population stabilizes, we hope by the fall. We're embedded in 125 schools across the state of New Jersey in 25 different districts. So what we learn in this center, interventions that happen here, is going to be part of that school-based program as well. And that ability to promulgate the evidence-based treatment, the expertise, the consultation is going to be available to all of those school-based teams. We have multiple mobile child crisis teams that go into the home in the Newark area and the New Brunswick area. They too will benefit from the knowledge of this and the training that will come from it. So as Fran says before, it's a gift that does indeed continue to give.
While we're on that topic of integration with the current medical system, there's a couple of questions about how this program would coordinate, collaborate with other medical services like the pediatric residency program, other primary care services. And while we're at it, thinking about some of the other disciplines that might be involved, like social work, education, et cetera. What are your thoughts on that?
Fran, would you mind talking a little bit about all the work we've done in terms of integrating physical and behavioral health and the work we've done with Cherokee and how that's growing?
Yeah, what's exciting about this, Brian, is that the nature of delivering behavioral health is changing. And one of the best practices or sort of evidence-based practice is this idea of, having a handoff between the doctor and the mental health provider. And so we have started looking at ways to embed mental health professionals into primary care facilities. And so this is a collaboration, an effort that Frank started, a couple of years ago, where we're trying to train students together from different disciplines, learning how to work together, how to provide services. And what I see happening in the center, in the Brandt Center, is using a similar model of integrated care where we will be having, we have the psychiatrist, we have the social worker, we have the physical therapist, the, art therapist, everyone is together as a team, wrapping around that youth and providing this very comprehensive approach to treatment. And so while we cannot treat, a number of people at the same time, what we're doing is creating a model and establishing best practices. And that's a model that can be replicated elsewhere. So the center really is this very special place where, not only will the residents who are being part of the, service-seeking population feel taken care of and feel nurtured, especially in a beautiful bucolic setting, very therapeutic setting. The folks who work there also, I think, will be inspired and will be able to share and disseminate some of the knowledge that they're, the experiences that they're having at the center.
Someone asked, what are the current philanthropic needs for the Brandt Center? I think that's a great question to ask. And just also to center that we've been talking about, how it expands, but I think people should be aware that the center is planned to be put located on Cook campus. Is that correct? Right. So what's the current status now? Where are we with groundbreaking or building and services? What's the current status?
The last really year has been spent with an architectural firm. The donor, Marlene Brandt, was very involved. This has been a very personal project for her. The use of the grounds is on Cook campus. It's part of the agricultural grounds. There had previously been hazelnut groves there, which was part of a long-standing hazelnut research project. Many people don't realize that there apparently was a worldwide blight affecting hazelnut production, and Rutgers, in a longitudinal study, finally cracked the code on that and produced a strain that was resistant to the pest that was inflicting it. Those grounds, that research was winding down, and there was a beautiful 4-acre campus that had natural trees on one side, a view of a small pond, and a view really of the horse farms that are there. And that's the process of land. It's off Riders Lane, if people know where that is. In terms of where it is, Fran, maybe you want to talk a little bit about sort of the timeline that's being expressed and all of the work that's gone on over the last year.
Yeah, it's really been a very gratifying project working closely with Marlene to realize her vision for the center. And as Frank said, it's in this very scenic, location along Farrington Lake, and lots of horse pastures and very peaceful bucolic setting with hiking trails, and really close to the botanical gardens, the Rutgers Gardens. We're at the point now where we are still soliciting support for this project. Anyone who would like to be a part of this vision can certainly contact the Rutgers Foundation and donate to this project. It's a project that is worthwhile, that will make a difference in the lives of so many of our youth. We are looking forward to getting to the groundbreaking very soon. And we do have plans already developed for the physical space of the project. We will start recruiting our top world-renowned psychiatrists and psychologists who will join the faculty and sort of be leaders in this space. So we're very excited about that. And certainly any one who'd like to contribute and be a part of this vision and part of this mission, we welcome that.
Brian, in terms of philanthropic needs, there are many, and many opportunities, I should say. Certainly one of the large areas for philanthropic activity at this point is helping to flesh out the institute that Fran talked about. In order to attract some of the best and brightest educators and researchers, Rutgers has to engage in searches that involve moving highly successful people from wherever they are to here. And that means recruitment packages. Certainly opportunities to help with those recruitments would be one aspect of it. There's also a whole other array, and anybody on this webinar who has questions about how philanthropic activity might be available to them, I really would strongly recommend that they contact the Rutgers Foundation. They have an entire array of opportunities for individuals, and would be more than happy to discuss those in detail. And it's people from really any range of interest, both, whatever the range of potential interests are, they've laid out possible opportunities.
I want to return back to the mission that you describe in terms of really increasing care and quality of care that you'd want to send your family members to. And you know, one of the barriers to that care is the stigma that is, you know, pervades our culture, in a sense that it's you know, maybe not a physical barrier or even economic barrier, but it's a psychological barrier that keeps people who need help from getting help. How do you think that that will be addressed, you know, within the center and within its philosophy and model?
You know, the idea of stigma and this sort of persistence of stigma among those who are seeking help is certainly one of the things that we have to address, right? So as educators, a big part of what we do is to educate our communities about the importance of mental health and well-being, about the importance of seeking help and receiving help. And so there, you know, we do have a School of Public Health. We do have our Graduate School of Professional Psychology and other such programs at Rutgers that really, it would take a concerted effort. And this is not just a New Jersey issue, this is a national issue. It would take a real concerted effort to continue to educate the public about the importance of behavioral health. And as I said before, you know, youth behavioral health is a national priority. From what I've heard, that, you know, several agencies that work with the youth have already petitioned the new president, President Biden, to create and address this issue of mental health and well-being among the youth. And especially given COVID, COVID has just sort of held up a magnifying glass to this issue, right? So we know that the need is there. You know, there's a lot of reliance now, and our young people are doing a really good job of talking about openly about their experience with behavioral health challenges, you know, whether it's on social media or what have you. But, you know, we can no longer hide. I mean, it's a challenge that has some real visible, even though it's so quote unquote invisible because people suffer in silence, it has some really visible impacts, whether it's on families, on relationships, on productivity, the ability to work, love and play, right? That's the basics of life and being. So we're looking to also provide these educational opportunities, whether it's for, you know, the public at large or just educating families about youth behavioral health and why it's so important to address these issues while people are young and not wait, you know, to bring it to the forefront. So.
We have the advantage being an educational institution. We do a lot of training. Not only do we do training with traditional matriculating students, but we also do training, for example, at UBHC. We work with between 4,000 and 5,000 individuals from the community a year to teach evidence-based treatment models to existing professionals, with families of individuals who are living with behavioral health disorders. We have a number of peer, both anonymous and you can do it non-anonymously, call lines that are available, including mom-to-mom lines for mothers living with children who have behavioral health disorders. We have cops-to-cop line, vets-to-warriors line. These are all designed to give people an opportunity to reach out when they're in need, maybe initially anonymously, and to have somebody support them in not being afraid or feel stigmatized about seeking care, much like they wouldn't feel stigmatized for seeking care for a physical health disorder. And we have to continue to move the ball, and that's going to be through a number of campaigns. It's going to be publicity. It's going to be individuals who themselves are in recovery, doing a better job of self-identifying. And you're beginning to see some of that now with sports people and other people that young people tend to look up to. Many people in the entertainment industry are being more transparent about their own recovery. I think there's much good in that. I don't want to be naive and say that we're going to be able to eradicate stigma, but I believe it's our responsibility to attempt to continue to reduce it. And I think I have optimism that we'll see movement in our time.
Yeah.
Yeah.
I mean, I really like the emphasis on education and training, and there's a lot that we have to do for both the populace and also for the practitioners at the center. It brings to mind that, New Jersey is such a diverse state, and there's so much across, from racial, ethnic to religious to socioeconomic. How do we make sure that our practitioners at the center are multiculturally competent and able to serve the diversity that we're going to see at the center?
Well, I think the training, to Frank's point, we are an academic institution, right? And we pride ourselves in being able to prepare citizens of the world, who either be in New Jersey or go out into the world, that are really well prepared to deal and work with in any situation. And, we have a new president. Well, he's not so new anymore, but President Holloway at Rutgers, who has been talking about, creating this beloved community here at Rutgers. And it's a beloved community, as I see it, as one that has compassion. And what better place to demonstrate that compassion than in caring for others and sort of having an ability to work with folks. And one of the nice things I like about psychology and psychiatry is that it really takes the individual circumstances into consideration. It's not sort of forcing you into one mold, but just looking at your individual circumstances and really considering that. And, I just want to say, I know that we're sort of coming close to the top of the hour, but in my role, currently as provost and executive vice chancellor for academic affairs here at Rutgers, New Brunswick, I am committed to bringing together the strengths of Rutgers, the research, the intellectual talent that we have here in New Brunswick. And the whole purpose of the university is to solve grand world problems. So when we look at the mental health of the youth or the behavioral health of youth in America, this is one of those problems, right? So how exciting is it that Rutgers can be at the forefront of providing solutions to problems that people find intractable, find, under-resourced, difficulty even identifying and locating services. We can be that galvanizing sort of center to make and move the needle on behavioral health treatment for youth. So this is an exciting initiative. I'm so humbled and honored to be a part of it. I'm so pleased and especially appreciative that Marlene chose this particular issue and that she chose to work with Rutgers on this issue. And I think it speaks to her belief that Rutgers can actually make a difference, right? And so with her gift, we will have the opportunity to do that. As I said before, this initiative really offers this opportunity to utilize the best science, the best psychological and medical science, which we have here. We have world-class medical enterprise that Frank is a part of. And, we've got all these partnerships in the community to really try to leverage these expertise and move the needle on behavioral health and looking at it, exposing it, making it available to folks and letting folks know the difference it can make. And, as a parent who has young children, and I have a 21-year-old son, and there are times when he struggles, and I'm, someone who's knowledgeable in the field. I'm a psychologist. And so I'm very much aware of that these problems that our youth encounters don't have to be permanent problems, that if you do the intervention at the right time, you're actually saving someone's life. You're actually changing the course and the trajectory of that young person's life, as opposed to someone who gets no treatment or the treatment is delayed, right? Then they're dealing with some added challenges. So I'm just very excited about this opportunity and that this is happening at Rutgers. I think it's just another expression of care and compassion for the youth, which I'm very passionate about. So I'm very excited about it.
I think there's so many directions that the center can go in. It sounds like it's really aiming to help many different youth and young adults. Some of the other concerns that are expressed here in the chat, in the Q&A, are about substantial problems in substance use disorders, as well as gun violence that results from young men being ignored, having their mental health neglected. How does that relate to these big problems that we're facing? How does the center even begin to, plant a flag in some of these problems?
Well, it is our responsibility as the largest academic center in the state, and as now, because of our affiliation as one of the largest, if not the largest, provider of medical and behavioral health services in the state. Our obligation is to develop programming in an iterative way that's going to try to address as many of those issues as possible. Although this is a marvelous project, and although this project I think will be a real capstone in the treatment of young adults and adolescents, we also realize that we have more work to do. We have more programs to build. We have more specialties to address. We will continue that. I've had the privilege of being here for 5 years, almost exactly the same time as Fran. And we have stood up several dozen new programs, whether they're call lines or school-based or clinic-based. We have, in addition to this project, several other projects. One is going to be addressing very specifically addiction for individuals 18 and older. We are looking at other programming that's going to address areas of unmet need, like obsessive compulsive disorder. This is a long commitment that Rutgers has to the state of New Jersey to build out programming that's going to improve access and provide evidence-based care. And I go back to the same point, the kind of care that you would prefer a family member to. You're looking at an extremely important project, but it's in a line of development. And we hope to have other meetings like this and talk about other new endeavors that are coming down the line. Our goal is to build them to meet the needs of the state and to do it in a way that they're sustainable.
Yeah, and I just want to add to that. One of the things we haven't talked about is just this issue of advocacy. And one of the things that happens in when you have a sort of a natural coming together and culmination of energy and investment in an issue is that you do get the attention of the legislatures, and that you can leverage the good work that's being done just to advocate for more resources. We certainly need lots of help. This is not a problem that one person can solve. Marlene is just helping us to kind of try to tackle this from a different angle and in an innovative way, in a way that sort of, sprouts many trees, so to speak. But I think that Rutgers and its sort of, prominence in the state can be an advantage to this issue, can call attention to this issue of the needs for behavioral health care for youth in our state. So while it's not a political project, it's really born out of her desire to help and wanting to make a difference. I think that the results of that, her kindness and her compassion can go a long way. So,
and I want to build a little bit on what Fran just said. Many of us, Fran, myself, Brian, I think you as well, in addition to providing support for building treatment, research, and training programs, many of us are active, both at the state level and at the national level, in advocating for more parity and funding for behavioral health and addictive disorders. I, for the last decade, have sat on the board for the National Association for Behavioral Health. They're located in Washington, D.C. Their sole purpose is to spend time on Capitol Hill, looking at key legislation, recommending new legislation, looking at parity between behavioral and physical health, instituting law and legislation that's going to better serve people living with behavioral health and disorders. So I think that while we are academic clinicians and researchers, it's also our responsibility, and Fran has been very active in this as well, at advocating for change in the way society values the needs of individuals with behavioral health and addictive disorders. That's going to be an ongoing struggle because there's lots of other groups advocating for other things. And we need to be a strong voice in support of the populations that we serve and we care about so deeply, as does Marlene.
Someone mentioned, one of the attendees mentioned here in the chat line about that kind of integrating some of these ideas about increasing the presence of mental health awareness, advocating for it, reducing stigma, that one solution might be giving all freshmen, incoming freshmen or first years into Rutgers undergrad, a course in mental health awareness so that it becomes more normalized, right? That prompts me to think, are there ways that this treatment center, we've been thinking more about training for professionals, et cetera, but are there ways that we've thought about in terms of how we can integrate with the larger university student body or the larger undergraduate system?
I would say, just based on my experience when I was the dean of the graduate school for applied and professional psychology, in some of our centers that provided services, we included numerous undergraduates who wanted to either have an internship experience or volunteer experience, or some, maybe they simply cared because they had a family member who, went through that particular situation. So we look for ways to always integrate and include our students in these learning opportunities. And I don't see us doing anything differently here. I think this would be a great opportunity. When you think about, that we have, this center, it's sort of, your dream center. It has, studios and places you can bring dance into it. You can bring in, like I said before, the arts, nursing, gardening, any profession at Rutgers, any form of study at Rutgers can be integrated in terms of curating the treatment for the individual. So yes, expert psychiatric care, expert psychological care, but also realizing that we're treating the whole person. And how can we use, if a participant has an interest in art or music, how can we bring that into the treatment to kind of provide a window for comfort for someone? So I would say that's a very exciting idea. Certainly we all need to learn a little bit more about mental health. More of us experience challenges with mental health than we let on. And so having a way to share that with our population or student body would definitely help with taking away some of the stigma.
We are heading towards the end of our time here. I do want to honor, there's been a couple of questions about the role of advanced practice nurses or nurse practitioners in this. And so I don't want them to feel left out. And so because we've talked about medicine, we've talked about social work and psychology, the role of nursing, obviously important.
Critical. And if I did neglect that, please accept my formal apology. we strongly advocate, in this day and age of great need and always limited resources, it's going to be critical for all of the health professions to have people practice at the very top of the license capacity that they have. And a key example of that is the fundamental and sort of continuous use of advanced practice nurses in helping to address mental health needs, including prescription medication, including being key members of the team. So a resounding yes. Advanced practice nurses are already a big part of our behavioral health delivery in both inpatient and outpatient. And we have every intent for them to play a role, an important role at this new center.
And Brian, thank you so much for being such an amazing moderator. Really, thank you.
Indeed, bravo. Nicely done, Brian.
Well, it's easy when the two of you have so much to say and so much experience in this, and so I guess in conclusion, it would be nice to hear from each of you either what the very next key step is this project or what the next hope is, so that we know exactly what focus our sights on the next goal down the line.
I'll go first. My best hope for this project is to get everyone excited and engaged in the project, to come forward and lend their resources to helping us do this work, whether it's through additional philanthropy, whether it's through lending their clinical expertise or training expertise or what have you. Right now, I think the next step for us is, as we move closer and closer towards groundbreaking, is to continue to build capacity in terms of our resources, financial resources that we can bring towards this project. So whether it's the Institute or the Brandt Center, the Brandt Center is our priority right now to get that center up and running. So that would be fantastic to have others join us in this and join Marlene in concluding what she started.
I couldn't agree more. I think as last comments, I think anybody who's on this WebEx, I would encourage you to tell people who may have been personally affected by this or who have a natural interest to please reach out. We would love to talk to people. We'd love to involve them in this process, whether it's on behalf of students or on behalf of people who may be able to use this process, or maybe it's just because you have an interest in the development or how it should look. We want to encourage that kind of involvement. Tactical next steps include things like finalizing the build-out plan, which is very much in line with what's been happening in terms of the architects and the builders. And then, Fran and I and others have to begin the process of recruiting researchers and key clinicians who are going to be a part of it. And since it's going to involve so many disciplines, we would heartily encourage, as we begin to identify those roles, that anybody who's on a call like this or anybody encourage them to apply to be a part of the project. We're excited about it, and we certainly hope others are as well. And again, Brian, thank you for your curating this throughout the time.
Well, I want to thank each of you, Provost Conway, Dr. Ghinassi, for sharing your time with us and your excitement for this project. I want to thank all of the attendees for giving us their time and showing their interest and enthusiasm, and for sure the Office of Advancement for putting this together, without whose coordination would make this difficult, and certainly for the inspiration of this Marlene Brandt for bringing us together in this way. I think we can give thanks as well. So I hope to hear more about this project and initiative, and hope to see those steps come to fruition. Please keep us informed.
Thank you very much, Brian.